Hello everybody, welcome to the September 15th All Provider webinar. Um, just to go over some of our webinar etiquette and structure, so you are administratively muted for this call because we're recording it and we would like to eliminate any of the background noise that we can. We are not able to unmute you, so you won't be able to verbally ask questions. However, there is a chat box that you can ask questions at any time during the webinar, and we will read and answer those at the end of each presentation. The chat box can be found in the box on the right-hand corner of your screen, and if this box is blocking your view, you can minimize it by clicking on the orange arrow, and you can bring it back and forth or open it and close it. This is our agenda items for today. Some of our items that were on the previous agenda were canceled. We were not going to be having a presentation by the Oregon Lottery because they had a conflict with our meeting today. So I think we will be getting done a bit early. So we're going to start with state updates. Then we're going to hear from Tom Moore from the Oregon Council on Problem Gambling around about the national conference that's coming to Oregon next year. We're going to have Tom also present on some data and some updates coming out of Herbert & Lewis, which is our evaluation and data collection contractor. And we're going to talk a little bit about the PGS implementation work plans, and then allow time for you to ask any questions that you have. After the webinar is over, you will receive a PowerPoint of this presentation along with a recording, and you will also receive CU certificates. They will be mailed to you either by the end of this week or early next week. And just in case you're new, we do know who is on the webinar. We aren't taking roll call, but we do know because we get a report out from the GoToMeeting system that lets us know who did log on and who will be receiving those CEU certificates. So the first update is that we're having our annual training conference gathering, whatever you need to call that in order to get approval from your administration, at the end of this month, September 29th and 30th at the Eagle Crest Resort in Redmond. Wanted you to know that there is still time to register. Registration does not close until September 26th, and so this on the screen is provided the registration link, and if you need any other information, if you'd like to see the agenda and lodging information, and you don't have that flyer, you can contact Patricia Alderson and she can get it to you. Otherwise, we're having our keynote presenter is Christopher Anderson, who is a longtime expert in the field of problem gambling and an expert around family therapy. So we're having a family therapy panel, and there's also a special prevention track on day 2 of the event. So hopefully we'll see you all at that event. Also wanted to let you know that the next PGS All Provider webinar will be December, the date is missing from that slide. So that date is December 15th from 9 to 10:30. And below it and on this form is the registration link, but you will also receive an email with an agenda emailed out to you at around mid-November, so you can register then. But we would like you to, if you're interested in participating, at least put that on your calendar so that you save that time and it's available and open for those webinars. Also, just another shout out about our training calendar for next year. This is a training calendar that you can find on the Oregon PGS webpage that lists all of our all provider webinars, our monthly prevention and treatment calls, and other upcoming trainings that we're aware of. In case you want to hold some dates on your calendars around these. Plus, you can also find the registration information for the webinars and the login information and phone calls for the monthly prevention and treatment calls. Once again, like I mentioned, we're having the National Conference on Problem Gambling next year here in Portland. So the regular general conference will be July 21st and 22nd, and the pre-conference will be the 19th and 20th. And Tom is going to speak a little bit more about that later in the presentation, but I just wanted you to be aware of that, and once again, mark your calendars or save these dates. So just some state PGS general updates. in past webinars, I had talked about how the treatment specialist position, we had a treatment specialist position a couple years ago, and when we went through our reorg last year at OHA, that position got moved under our compliance unit because it was doing similar functions as those other compliance specialists within our office. So we needed to go to the legislature and ask for a new position, and we had drafted what we call a policy option package here at OHA to ask for that authority to hire that position, and it was going to be a program analyst position that would provide technical assistance in program and policy development. And so we wrote that policy option package. It got approved by our administration here at HSD, and it got moved up to the OHA cabinet level, and then it did die. Unfortunately, OHA will not be asking for any new positions during this next legislative session that starts January of 2017. It's kind of understandable that they wouldn't ask for any new positions, as a year ago we did go through this reorganization that did lead to many layoffs, and we are still in transitioning from this, and so it does make sense that we wouldn't go and ask for new positions, as we haven't ever gotten everything quite figured out yet. So what that leaves us is with out of treatment specialist for another 2 years for the 2017-19 biennium. So we will ask for another position when we have the opportunity. That could be during a special session in February of 2018, or we might have to wait till the legislative session in January of 2019. So with that said, we're going to transition some of the roles and responsibilities of the two staff people that we have, which is Roxanne and myself. So Roxanne's time is now going to focus on prevention providers and prevention and outreach activities within the PGS improvement plan. So we're going to be giving her a new title of Problem Gambling Statewide Prevention and Outreach Specialist. Titles aren't always that important, but she's also sitting on a lot of new committees, some of them on national level, some of them are just local here within Oregon with other stakeholders, and we just felt that it was important for her to have a title that helped explain the work that she does for us here within our system. So that's why we did that. So my time is going to be spent focused on the budget, general system administration, contract monitoring, and the treatment providers and these activities within the PGS improvement plan. So things are changing a bit back to kind of how they were. So now I would be handling any variance requests for treatment. However, we want to make sure that you understand that there is no wrong door to ask a question within our system. If you ask a question of Roxana or myself and it's not the area that we are focusing our time in, it does not mean that we would not answer those questions. It does not mean that we would not shuffle that question to the right person. You will get an answer because we support each other. We try to stay on top of what each other's areas of focus are, so that there is always a timely response, and we can cover each other when people are on vacation or out of the office. So these are just general transitions, but not too much is actually changing within our system. Next, I just wanted to once again remind you that you can get your monthly helpline data from the Oregon PGS webpage, and that can be found under the research section, and the web address is listed, but that's where you can find all of the helpline data if that's something you want to look at your referrals and how maybe you're providing a specific effort in your community to see if that's increased your referrals. So just calling that out again, that we have that data. And I will tell you that it's probably not quite as up to date as it should be, but we'll work on that this week to get that up to date. Our web posting person is out of state right now, so everything should get put on it by the beginning of next week. So Roxanne has her report on state prevention updates.
Thank you, Greta. So quickly, just a reminder that the next Prevention Connect Go-To meeting is scheduled for October 20th from 10 to 11, and so we will be sending out a reminder about that call in the first part of October. And another component of that is to keep in mind that on the months when we have all provider calls, it does conflict with the state prevention or our Prevention Connect call, so we do cancel the Prevention Connect call and encourage everyone to participate in the all provider call. So the link is here, but we'll also be sending it out for you later. Also, somehow there's been a little bit of a system I'm just going to call it a failure for somehow my email address got out there for folks to use that had the, instead of reading the roxanne.rjones@state.org, it added the DHS-OHA into the email address. That will route emails from external partners, so all of you out in the field, that routes it to my junk mailbox because it's actually an address used internally. And so please make sure if you have either mine or Greta's email address in your system and it includes the DHS OHA in the email address, go ahead and delete that address from your mailbox and make the change to the correct address, not including the DHS OHA. We are monitoring our junk email address, our junk email box right now pretty closely, but we don't want to miss any correspondence from any of you from the field because we do strive to respond to those in a timely manner. So just check that, and if you can make those changes if you have it incorrectly, that would be fantastic. We had the opportunity to put out a funding opportunity to the prevention program statewide to apply for some funds to implement a special project that focuses on adult outreach and a community in regards to problem gambling. And we had 16 programs apply for those funds, and we're happy to announce we are able to fully fund all 16 of those projects. The projects will can start now depending on the capacity within the community as the contracts are getting updated, etc. And will be ending on December 13th of 2017. Variety of projects focusing on general adult population as well as looking at the older adult population. Some great projects out there were proposed, and we're really looking forward to seeing how those go. We'll have more information about those projects as it becomes available. Also wanted to let folks know that both Susan McLaughlin and Sean Martinez will be serving on the National Problem Gambling Conference Prevention Committee. So they both volunteered and stepped up and to help serve on the committee that will be reviewing the proposals for the projects that are being put forward to be presented at the national conference in July. So we're excited to have them. They'll be joining me as well as other folks who are brought in from the through the National Conference or Council on Problem Gambling. So, but a special thank you to those two for stepping up and volunteering. More to come as we know about what that track will look like, and we'll make sure to keep you guys in the loop. And we're hopeful that once the call for papers is submitted or distributed out into the community, that many of you will step up and be willing to present at the national conference in July. So with that said, also, I just want to say a reminder about the special prevention track at the fall gathering here at the end of the month, starting on the 29th. And the fall gathering will be on the 30th. It'll be in the morning, and lots of new and exciting stuff coming your way and discussion to be happened there. So looking forward to seeing everybody there. And that's all I have. Thank you, Greta.
Thank you, Roxanne. Okay, so now for some treatment updates. So the October 5th treatment call, I have canceled that call due to the fact that we have the fall gathering the week prior. So the next call will be for November 2nd, and this agenda is going to focus on a discussion and training on problem gambling, on the problem gambling section of the OAR. So within that section, there's some information about telephone counseling, financial and suicide component, and we are going to talk about what your agency needs to do in order to meet these specific components and have your site review go smoothly for as far as the problem gambling section. So we hope to have you attend that and get some insight on how to achieve a smooth problem gambling site review. My second announcement for treatment is that if you recall, we started a performance-based contracting back in July of 2015, which we had allowed treatment providers to earn incentive payments if they achieved any of the 5 proposed performance metrics that we had put forth. So we have implemented this for 1 year, and we gave out incentive payments back in late May regarding the first 6 months of data that we had collected. And we now have 1 year's worth of data, and we'll be giving out incentive payments in October, which we'll be reviewing the data in October, and your payments will probably not come out if you have achieved them until January of 2017. However, it has been determined that this method of incentive payments for problem gambling services is a bit administratively burdensome for our state contracting system, and it's very difficult for us to implement on a budget that cannot be carried over from one biennial to the next. So this system did not really work for problem gambling services. So effective immediately, we will not be implementing a performance-based contracting system for this fiscal year that we're currently in, 2016 and 17, as we had once stated. So the measures that we were looking at are the same measures that you are held accountable for within your contract language. You just won't be receiving any incentives if you achieve them. You still do want to try to achieve those performance metrics because your funding is based on those, partially based on those. So, but we won't be having any more incentive payments provided. If you have any questions about this, please don't hesitate to contact me, as this is something that we are stopping immediately because we are in this fiscal year, and I want everyone to be clear on how we're progressing and how we're moving forward. The other announcements I had for treatment specialists or treatment providers is that we have added some new codes to our procedure and billing code document. First off, we added a family psychotherapy code. Or we added some family therapy codes for licensed professionals that are providing family therapy. So when you are referring a family member of a problem gambler to your family therapist within your agency, these are codes that they could use if they are licensed or meet the qualifications under our document. So this is going to allow us, by having different codes for family therapy, it allows us to know what agencies are providing family therapy by a family therapist or a licensed practitioner. It allows us to know what type of therapy is being provided, because we have 3 different codes: family therapy without the patient present, family therapy conjoint with the patient present, and then multifamily group therapy. So this allows us to know in more detail what's being provided, what professional is providing it, and it also has a higher reimbursement rate when you use a licensed professional. If you are a gambling clinician that is not licensed and providing family therapy, then you would continue to just use the individual counseling code H0004, and we will know that that's also family therapy because the client has been enrolled as a family member. If you have any questions about that, please don't hesitate to contact me. We also have a few other changes to the billing codes just to let people know that we've always had our peer delivered services codes, individual and for group, and we just wanted you to know that these codes can be accounted for as an aftercare service too. So if the client is still enrolled in your services and is getting aftercare, they can also receive peer delivered services. Additionally, we have a new code for people for gambling clients that are dually diagnosed and need some mental health services, but they do not have any health insurance or a way to get those provided, but it is essential that they get these mental health services while they're getting their problem gambling treatment services, because without one, you don't succeed with the other. We have initiated a psychotherapy 30-minute code for those licensed practitioners to provide this mental health service to your gambling client. At this time, so this one, just to be clear, this code is for clients that do not have any existing health insurance coverage, and it is the goal that the patient is working to get enrolled in the Oregon Health Plan or connected to another health insurance option, and this is to cover for that time period. At this time, we haven't put any restrictions on how many times the service can be provided. However, we will review this data to see how this code is being used, and if we feel that it's being used for too long of a length of time, we might need to eventually in the future put a limitation on timeframes. And just a quick reminder that we have a new code for Medicaid management, a GMed code. The existing codes that we had been using were expired from Medicaid system, which made them expire and not be usable for many of the billing systems within your agencies. So we have initiated a new specific problem gambling code called GMed for medication management. So I just wanted to call that out because an email came out about that around July 1st, but previous to that I had sent out an email with the new PGS procedure and billing code changes for the fiscal year, and that one needed to be updated after I had sent my original email. So all this information and the new PGS procedure and billing code change form will be sent out via an email to all of program managers, clinical supervisors, and clinicians later this week. Another thing I wanted to mention is that we got an email here in our office about this 211 information system. This is a one-stop directory, and I went onto it, and many of our gambling treatment providers are not listed. So the website to this 211 info system is listed on this page. And this is what the page looks like. And even though I am saying that many of our treatment providers aren't listed, I'm sure many of our prevention providers are also not listed. And it might be something, if you have a particular service that you want to promote, that you in prevention world might want to also be listed on this 211 info page. So anyway, I'm just showing you that this is where I went. I went under the search button of the page, and I just put in the zip code for Salem. However, I did put in the zip code, I selected the city of Medford, and I selected numerous different areas, and actually wherever you put in your location, you get the same results. There are only 7 results that you get for problem gambling treatment when doing a search. So, and they were Cascadia, Lewis and Clark, Lifeways in Ontario, OPGR was listed on there. Anyway, there's only 7 results, and this is a great opportunity for you to get registered on the site. I believe it's free and it's fairly simple to get registered. You just go to the website listed, 211info.org/providers, and you can register and you put in some information. Very simple. It's a good marketing tool, so I would recommend that you take a look at this, see if you're listed, and talk with your program managers about getting listed on the site, because it may be that you're not listed for the other services you also provide, but we want to make sure that these treatment Gambling treatment services are listed, and also problem gambling prevention services if that's something that you want to do as a prevention provider. So that's just an FYI of a resource that has come across our desk that we think that we're not being represented on, and that would be a good marketing tool for your agency. So that is all of our state updates. So is there any questions, Roxanne?
None have come in that needed to be responded to, other than just to.
Roxanne, you need to unmute yourself.
Oh, sorry about that, folks. We haven't had any new questions come in. Just one in regards to making sure that we were going to send out the new code and rate sheet, which, yes, we will ensure that goes back out to you guys, but haven't seen any other new questions.
Okay. Okay, thank you. All right, now we have Tom, who is going to present on stuff from the National Council and also from some data he's received. So, Tom, I have unmuted you. You are ready to go.
Okay, next slide, please. Perfect. As Greta and Roxanne both have mentioned earlier, the 31st National Conference on Problem Gambling in Portland in July of next year. There's going to be a call for presentations are going to go out probably in the next week or two. And the general theme of the conference is going to be listening, learning, leading. And there's going to be, again, 4 similar tracks that they've had in the past: treatment, responsible gambling and regulation, prevention, recovery, and community. So what we're trying to do is to encourage as many folks from Oregon that have programs that they're doing in prevention and treatment, prisons, whatever, to prepare proposals for the presentation. We'd really like this to be a showcase of Oregon. So a couple things to keep in mind in doing those presentations or doing the proposals. One is that there's a national selection committee. Actually, there's 4 committees, and Roxanne mentioned one. So lobbying any of the folks locally is not going to do you a lot of good to get your proposal selected. It's going to have to go through this national committee. So one of the things that that I'm suggesting is that once that call for presentation comes out, we'll get it circulated as broadly as possible, and you know, do your brainstorming and preparation early. And the other thing that I'm really encouraging folks to do is to kind of get a peer review of your proposal. So, you know, maybe somebody in your agency, somebody outside your agency, you know, a peer in another organization or something like that, have them review it and kind of, you know, get their impression of because the proposals are pretty limited in what you can say and do in those things, and have them review it to say, oh yeah, that sounds exciting, I'd like to go to that, or give you some feedback on that, because we'd like to be just as competitive as possible in getting these proposals submitted. We do have, Roxanne had mentioned one committee. There's a conference committee, and under that there's subcommittees for treatment, responsible gambling, regulation, prevention, and recovery communities. So those, we've got a couple people on each one of those committees, and then national, in the next couple weeks, are going to be selecting people from the national, international community to also sit on those committees. So I'm expecting that to get rolling along pretty soon. There will be a call for volunteers at the conference, and that'll come up a few months. I'm envisioning that coming up a few months prior to the conference, and typically 10 to 12 to 15 people are needed to kind of go into the sessions and scan people, participants' barcodes to make sure they get the participants registered for their CEUs, and also to collect presentation evaluations and stuff like that. What National typically does with this conference, if you volunteer and there's a presentation that you'd really like to hear, then they'll do what they can to make sure that you're responsible for kind of helping to host that session that you want to hear. So it's a good deal all around, and we will need 10 to 15 volunteers to work the conference, both the main conference on July 21st and 22nd, and also the pre-conference on the 19th and 20th. So we're all looking forward to that. It's going to be a lot of work and a lot of fun and a lot of efforts going into this to make it really a good conference. So if you have any comments or questions or anything like that, please forward them to me. Next slide, please. What we've done, now putting my other hat on, I'm sure you all saw I went from my cowboy hat to my crash helmet. What we've done is we've gone back to a format similar to what we used to do long time ago with the quality improvement report. And Greta had suggested that we do this. And what we're going to, instead of just looking back, looking at the immediately past 6 months and then comparing that to the 6 months prior to that, we're going to go back and look at 4 periods. So next slide, please. And what we've also done is we've taken away that sort of report card format kind of thing where we had, above average, below average, and compared this 6 months to last 6 months and stuff like that. What we're going to do is we're going to try to make this a more streamlined report, and simply whether the criteria was met for each one of the measures, or that it didn't meet the criteria. So again, just as a real quick review, excess weight, we need to have 90% of those forms. Well, I'm getting into reporting there. Let me skip that. The 90% of the folks, the expectation is 90% of the folks, and this is for gamblers and family members coming into programs. The expectation is that they will have an appointment offered to them within 5 working days. And system-wide, we've been doing pretty good, about 3 to 4 days, 3 to 4 calendar days. So we've been doing excellently. The retention criteria, again, is 40% of the folks that are discharged during the period will have 10 or more sessions. If there's questions about that, you had your small program, you've had some assessment onlys or some brief folks in for brief therapy and stuff like that. We advise Greta, and Greta looks at that, takes that into account when she reviews these things. Successful completion rate, again, you guys all know the formula for that. We're looking for an adjusted rate of 30% or greater. And for that criteria, we're looking only for gamblers. And the reason that we're not paying a lot of attention, I don't know what the better word would be, for the family members is a lot of times the family member programs are not really as formalized as the gambling treatment plans are. So we wanted to kind of avoid having a lot of confusion around what's a successful completion for the family. When reporting, again, 90% of admissions in our office within 14 days, and those can be mailed or faxed. Discharges within 90 days of the last service date. And just as a reminder, every month we send out a list of folks that appear to be open longer than a year without any waivers. So we're trying to really cut down on that, and we're making a pretty good dent on that. And then the encounters reported within 30 days of the close of the reporting month. Penetration is the number of people coming into treatment. What we're looking at is 2% of 2.7% of the population in your county or in your catchment area if you're covering more than 2 counties. Length of stay, we've really changed that again, and what we're looking at is having 0 cases open over 365 days without a waiver. And authorizations for follow-up, this is really critical for us to be able to have the authorization and permission to follow up folks for their 6 and 12-month follow-up. So what we're looking for is a minimum of 80% of gamblers and family members consent for follow-up. If you're having any problem doing that, let me know, and we can do some coaching on how to come back and get that. And then enrollment surveys, we cut back the record abstracting form here a couple years ago, and we've cut it back before that. So we've really become dependent on the enrollment surveys for the gambler and for the family for all the demographic and behavioral information that we use to evaluate the program and to describe the program and track who's coming in so Greta can do her planning. So the expectation is that 95% of gamblers and family enrollment surveys will be completed and mailed to us. And then the client satisfaction has not changed. What we look at for that one criterion is a minimum of 85% of the folks completing the semi-annual survey will indicate a willingness to recommend the program to others. So next slide, please. Let's go through this real quick. So the new report, what we're going to look at each one of those reporting criteria, and the reports are going to be much more streamlined, as I said. So the chart one is the excess wait time. So you know the number of gamblers that went into that. This is a mock-up. 42 gamblers, 2 family members were enrolled during that 6-month period. So what we're looking at there is we're looking at 2 years worth of data, and we can see that over the last 3 years, January, June 15 to July, December 15 to January, June 16, that there's been a decrease in the percent of people that have met that criteria. So something's going on with this example program that suggests that maybe we want to be looking at that. And why do we have the appearance of a trend over the last 3 reporting periods? Fewer people making it into the treatment program. It could be staffing, it could be any number of things. Next slide. Again, this is the same thing looking at retention, and with this example, we see a pretty good trend that the number of people staying, the percent of people staying in treatment for at least 10 sessions has gone down. Now that begs further investigation on our part with the program, that maybe they've changed their format, maybe they're going to more brief therapy, and that's working. Next slide, please. The successful completion rate. It just dawned on me, this program needs to be called. again, what we're seeing is a decline in the successful program completion rate. One of the things that we know when we see that kind of thing happening too is when we've got a retracted system, if you will, that people are staying in longer. The people that are successful are engaging in treatment and staying longer. So the discharges that we're getting, there's a higher frequency of them being not successful, just kind of giving up and going somewhere else. Next one. Now this is one of my favorite ones, and it looks like it's really confusing. The green dashed line is the minimum 90% of the admissions, discharges, and encounters are reported. So this is interesting that for this example, what we can look at very quickly is that there's a slight downward trend with the percent of admissions are being reported in a timely manner. So that would require some further questions and some further thought. But with the number of discharges and the number of encounters, percent of those being reported in a timely manner, those are all going up. So that's the kind of thing that we want to look at and to really see and to kind of give a kudo to the programs that are making those kinds of improvements. Next slide. And this is the penetration, the actual number of folks based on what our projections are for the county. And next one. And this is the kind of chart that we're looking for the number of open cases over 1 year with the waiver. The target is down there on the 0, and the program has had, it looks like one chart in July, December 14 was open, and 1 in January, June was open. And what we're seeing and looking at the overall data is that a lot of times what people are really cleaning up their records. So 1 year we'll see 30 records are open, and the next time we run that data, there won't be any open because they were all closed and taken off that chart. Next one, please. And then the authorizations, similar data, and then next one. Surveys, again, looking at a trend that's going up for this example, and the final one. And this is the willingness to recommend. So this particular agency had 25 surveys during the semi-annual period, and the willingness to recommend was very, very good, 100% in January, June 16. What we don't have on this presentation is for those of you that submitted the semi-annual surveys, we are making up a chart that will provide that information to you with this report, and we'll probably have those to Greta in about a month or so, I think, and then out to the field after that. So you will have your semi-annual satisfaction data. One of the things that we did run into, however, was that a lot of probably a third of the folks who submitted surveys during the January-June 16 period used the old format. So we're not going to have complete data for everybody, but the essential satisfaction data we'll have and that. So we're looking forward to having this streamlined report. Hopefully more people will look at it and it won't be as confusing and a lot cleaner. And that's it.
Thanks, Tom. That's great. I like the new look of the charts and how to look at the data and review. I think it's going to be a lot more telling and a little easier to understand and read. Roxanne, did we have any questions for Tom?
No, I'm not seeing any questions at this time for Tom.
Okay, then we'll continue on. But Tom will remain on the line if there is questions that come to you by the end of this webinar today. Okay, so I just wanted to talk a little bit about the PGS implementation work plans. As I stated in previous webinars, this is our big strategic plan for our system. It's our 5-year system improvement plan, and we will continue to talk about it and at every webinar to let you know what progress we're making, keep you informed on how our system is moving forward and what Roxanne and I have been up to, kind of for you can hold us accountable. Just to review really quickly, there are 6 implementation plans. There are 6 initiatives within the larger work plan: collaboration, workforce development, integration, prevention, treatment, and recovery services, rural services, and funding and reimbursement. So these, the plan and the work plan can be found on the Oregon PGS webpage, and we've listed that website for you. So if you ever want to take a look at where we're headed and what we're doing, where we're going. But today I just wanted to focus on stuff that will be occurring within the plan for this coming quarter, which we're calling October through December. This is pretty much, we've started slightly implementing some of the activities within the plan, but this is really our big kickoff time, would be starting in October. So I just wanted to go over about 10 items that we're going to be working on and letting you know what we've done thus far. And then at our next webinar in December, we'll talk about these focus areas again and report on how we've made progress along with what we'll be doing starting on in the next quarter. So the first thing is that we are going to begin the development of a best practice resource guide for problem gambling services. So this is a joint effort between Roxanne and myself and a contractor that we've contracted with to help us with some of the activities within this plan. So this is going to be a guide of many different resources that will help people who are new to the system or who have been around the system have a resource that they can put their fingers on and find information fairly easily. So this guide, we don't have it all envisioned yet what it will look like, but it will be something that can be printed, yet it'll also be online electronically, and it should be always evolving with new information. Second off, we're going to be exploring and continuing to reach out to the older adult population. We are trying to determine and learn how to educate, engage, and treat the older adult population and what are the best practices around this. So we've started doing this by we have connected with our older adult specialist here at the Health Systems Division, who has got us connected with some older adult specialists in the counties or in regions across the state that are funded to do some specific work with older adults around mental health. And next month we'll be going and providing a presentation to those older adult specialists about problem gambling and how we can partner, and letting them know that there are prevention and treatment people within their communities that they may want to connect with. So we'll give you an update on that. Just yesterday, Roxanne had gone out and made a presentation to the National Association of Social Workers around problem gambling. She actually did the end of the presentation just on the resources, and Nirmala, who is our older adult specialist who is partnering with us here at HSD, actually got invited to do the presentation, and she did the presentation on older adults and problem gambling. She also had done this presentation at the Focus on the Future conference in April, and I think that someone in the audience must have heard her there and then invited her to come and do that. So we have this partnership with Nirmala, and she is keeping us and thinking about us and problem gambling when she's going out and doing her work, and she's helping us develop even more partnerships. So that is great. Additionally, many of the awareness grant opportunities that were available to the prevention coordinators had a target population of older adults. So we will be having some older adult activities going on in numerous communities, and that should provide us with a lot of great information also. And so we're really excited for those grants to get started, and then we're really excited to see what comes out of those. So that's another way that we are continuing to look at the older adult population. Along with, we have a special project through Cascadia in Clackamas and Multnomah County. They have received some additional funding on the treatment side to work with a program called Views, which is a Cascadia older adult program, and they are doing some focus groups around those around older adults that they reach to learn how to engage and how to treat the older adult population. So a little bit of that information was presented at the Focus on the Future conference if you were there. However, it was very new. They hadn't actually had too many focus groups at that time, so the data was very raw and very small, and so they're looking at, they're currently in the process of doing more focus groups and learning more information. Another focus area is the development of an Eastern Oregon respite service, and so we have touched base with New Directions Northwest in Baker City, and they are interested, and we continue to work with them to set up the requirements and logistics around how that's going to work, and we are hoping to have that service be available by January 1st of 2017. Additionally, we are continuing to develop our relationship with Public Health Chronic Disease Division. That is actually their real name. I didn't know their real name, so I made that up, kind of up. It is the chronic disease. They are about chronic disease. And this is where our substance use prevention unit or people who used to be within HSD now sit. And so we need to make sure that we have a good relationship with this division as we move forward, because many of our problem gambling prevention providers in our communities are also substance abuse prevention providers. And in order to have good integration and collaboration, we need to know what changes may be occurring within public health and how that impacts our providers and how we move our system forward so that there is the least amount of impact as possible. We're also going to begin seeking out a relationship with the Department of Education. In the past, we've had relationships with this department. However, with staffing changes of our own office and their department, and changes within their structure, we kind of lost our relationship with them. So we're hoping to regain that relationship, and so that we have a place at the table when they're looking at what kind of stuff they're doing in the school system around problem gambling. And we offered, like Roxanne had mentioned, we offered and are now monitoring community awareness grants, and these have been funded. So that's a way that we're bringing more awareness around problem gambling into the community. We're also going to be developing a contract for a positive community framework campaign. This is a campaign messaging campaign, media campaign, and it is a framework that has been very well researched and out of the University of Montana, and we hope to bring that campaign here to Oregon either in January of 2017 or in July of 2017. So more information will be coming on that and we'll have we will have Roxanne do a presentation, a short presentation on the positive community framework. In future webinars, for those in the treatment field that aren't familiar with it, many in the prevention field, and for those in the prevention field that aren't too, but many of those in the prevention field are very familiar with this framework, as it is a framework that they implemented on the substance abuse side a few years ago and continue to implement today. Additionally, we have our Oregon Prevention Data System, which is the data collection system that the prevention providers use to collect their prevention data, a system that was implemented in around July or September of 2015. And now we're moving forward to, so they have been putting data into that system and their plans, and now we're going to move forward to how do we pull that data out and create reports and dashboards that we can look at and show the progress that's being made. So we're really excited about that. We're also going to explore the development of core competencies for problem gambling treatment providers here in Oregon. Currently, there are no core competencies that are listed that a problem gambling treatment provider should have. And so we're going to explore whether there's something at the national level, something out there that we can copy and expand upon, or if it's something that is deemed as necessary. On the prevention side, there are already core competencies that are attached to your Certified Prevention Specialist certification, so we won't need to develop those on the prevention side, but there is nothing on the treatment side that is attached to certification, so we're going to look into that. And our contractor who's helping us with some of these projects is going to be looking at it at the national level to see if this is something that at the national level they would like to implement and develop, and then we can model ourselves after that, or if it's something that we just want to do here in Oregon on our own. Additionally, we're going to develop a treatment provider technical assistant visit protocol and process. Since our system is not actually providing the site reviews anymore, we want to be able to make sure that we're still involved in the treatment system and knowing what treatment providers are doing, making sure that they are going to meet the OAR requirements during the site review process, and also looking at what their system looks like and how do we provide technical assistance around that. So you do have site reviews on the treatment side and the prevention side every 3 years. However, we want to make sure that on the treatment side, we are going out and doing some type of visit, looking at some of the things that you might have looked at during your OAR site visit, but additional things also. And so we're going to develop a process to see what that looks like. So just something that will be coming down the line. We're also looking at other types of helplines structure and outcomes. So we have our helpline, which is a great resource and a great service, and they do a great job, but we want to look to see what other types of helplines, what other type of processes do they use to engage with the public, engage with those that they're trying to serve, and how do they do a referral process, and just to see if there's anything else that we could integrate into the system that we currently have to make it even better. The other thing we're going to do is we're going to incorporate some trauma-informed language within our contract and service element language. So right now we're in the middle of updating our contract and service element language for the next biennium, and we have incorporated some stuff around trauma-informed. And when when the contracts language is finalized, we will share that with you. But just know that the language that we've incorporated, we are fully committed to support you in making sure that you can achieve these contract requirements. But we wanted to incorporate some trauma-informed language into our contracts so that we can ensure that our services are trauma-informed, and then that will force us to also support you in making sure that that happens. And then lastly, we just wanted to explore and implement alternative funding models for client finding outreach. So we don't know exactly at this time what that means, but we have drafted a contract language, service element language around client finding outreach and funding it through a service element. And we can use this contract language if we choose to, if we tie funding to it. So we've opened the door up to changing the client finding outreach model. We don't know what that looks like, but we've initiated opening the door, allowing us the access to be able to do that. So those are the things that we're going to be working on for the next 3 months between Roxanne, myself, and our contractor. So as you can see, we should be busy because we'll work on these amongst the other things that we do day to day. But we feel that they're all achievable. It does not mean that they all have to be completed by the end of December. It just means that we are getting started on these, and then we will report back on the progress that we're making on them, along with some other focus areas that we'll start on at the next quarter. So that is the end of the report out on the system improvement plan and the activities that we're working on. And if you have any questions about that, you can ask those now. This is our contacts people, but basically this is the end of our webinar today. So we got done a half an hour early, but let's see if Roxanne had any questions from any of you.
So at this time, we haven't had any questions, but we did have a clarification that the unit that the substance abuse prevention program is sitting in public health is actually called Health Promotion and Chronic Disease Prevention. And as we move forward, we'll continue trying to incorporate that language in, I believe they call themselves HICCADIP. But anyway, so we have that, and then I think that's it for questions that I'm seeing so far.
Thank you, Roxanne, and thank you for the person that clarified the name of the Public Health Division, as I was just being lazy when I made that slide, and I apologize for that. I should have actually looked it up. Okay, so if there's no other questions, I think just the last thing I wanted to mention is I believe that many of the treatment providers may have received an email from Dee Simmons from Bridgeway, who is their intake, I don't know her exact title right now, but it's something like an intake coordinator. And she did mention that there was this was last week, so there was one bed open at the residential treatment facility. So if you are thinking that you have a client that might be interested in residential treatment right now and is at the right level of care of needing that, then please contact Dee to see if to get that paperwork rolling and see if you can get that client in and that we can get that bed filled. Otherwise, I'm going to go ahead and let you guys all go, and you'll have an extra, hopefully, half an hour of your day to do whatever you need to do, because we are basically done, and I hope to see you all at the end of the month at the fall gathering, and if not, then hopefully I'll just hear from you at some point via email or phone calls to know that you're still out there, still doing good work. And so thank you for your participation today, and I wish you a great rest of the week. Thank you.